Welcome to the Sunday Paper Roundup, public edition. I've decided that sounded better than patient edition because lots of people have watched this of physios, active people with knee pain, and people generally interested in knee health. This new week, we're looking at new evidence about treating meniscus root tears. This is one of the most devastating meniscus injuries you can have. It's where the meniscus pulls out of the tibia by its attachment, almost like pulling a tree out by its roots. I'll link a video. When that happens, the meniscus can stop working properly, joint pressures rise, and the knee can start to wear out much faster, and you can get accelerated osteoarthritis. These tears can happen with a twist, a squat, stepping awkwardly, or sometimes with surprisingly little trauma at all. They often cause sudden sharp pain, difficulty weight bearing, and they're often missed, especially in middle aged patients, although we are much more aware of them. Now, traditionally, we thought these tears needed to be repaired early, or the meniscus may extrude, deform, scar down, and become much harder to repair. And to be clear, this new paper does not say that timing no longer matters. What it says is more nuanced. This week's paper is from the American Journal of Sports Medicine, and it looked at whether timing affects the results of a medial meniscus posterior root tear repair. And the key message is this: patients who had surgery within 3 months of the injury did best, but even patients who had surgery after 6 months still improved significantly. And that matters because although early diagnosis and early treatment still give the best outcomes, this paper suggests that late does not automatically mean too late. The author still acknowledged that in more chronic cases, the meniscus may scar down and extrude or come out of the joint, may need extra techniques like meniscal tibial ligament repair or centralization to help reduce and control it, to put it back and keep it there. So this paper should not make us relaxed or complacent about these injuries, but the practical message is think root tear early, refer early, and repair early wherever appropriate. But if someone presents late, that doesn't automatically assume that the meniscus is beyond saving, and that's the real takeaway. I'll see you next Sunday. I'll keep breaking down the evidence as it lands.